Good morning, good afternoon, and good evening to all our fellow patient advocates, our esteemed speakers, our stakeholders, and partners. Allow me to welcome all of you as we go virtual for the second Asia Pacific Patients Congress. It was only last September during the Global Patient Congress when Ayappo joined the call for national and global solidarity and stood with the global community in its fight against COVID-19. We at Ayappo are celebrating our coming of age, 21 years of helping shape the global healthcare policy agenda and advocating that patients be at the center of healthcare systems. Ayappo's unique mission and our worldwide footprint puts us at a distinct advantage as a member of civil society serving as a global voice of patients. Allow me to share the Ayappo at 21 audiovisual presentation. Play video, please.
The International Alliance of Patients organization has helped shape the global healthcare agenda for the past 21 years by putting the patient at the center of healthcare systems.
With an ECOSOC consultative status, this gives us a unique opportunity to raise issues of global health importance at the member states and with other leading non-state actors at the World Health Assembly and the UN General Assembly. We distill health and policy issues that are agreed at the World Health Assembly and the UN General Assembly so that members can understand in real terms what their government should be doing.
We take information from the WHO reputable journals as well as patient experience and distill it down into practical, digestible and actionable information so that the patient can confidently engage in dialogue with their physician.
Ayappo is the global voice for patient-centered healthcare, and the value it brings is to provide members with a range of toolkits and policy briefing papers to help them advocate at the grassroots level.
Make the patient's role stronger by ensuring they're seen as equal partners. Ayappo is responsible for the first globally accepted definition of patient-centered healthcare, and it's one that was developed and agreed by patients' organizations from around the world.
Since 2005, our biannual Global Patients Congresses help our members build their skills and knowledge, as well as extend networks of patient advocates from around the world.
Every year we have a Patient Solidarity Day and a World Patient Safety Day that brings us all together to address common challenges as a single patient body.
We currently have 271 patient groups across 71 countries and work in 52 disease areas. And our work is greatly enhanced by our cross-sector alliances and partnerships.
Our cross-sector alliances involve working collaboratively with like-minded medical and health professionals, policymakers, academics, researchers, and industry representatives towards patient-centered healthcare and universal health coverage.
Our healthcare industry partners commit to supporting us with various levels of unrestricted financial support, which in turn support accountable, transparent, and efficient collaborations.
The pandemic in 2020 has clearly highlighted the need to make major changes and future-proof our healthcare systems.
Never before has there been a greater need for an alliance such as Ayappo. A diverse, inclusive, and multicultural organization is truly most effective on a global scale.
We can all recover together, and we can address our challenges effectively through national unity and global solidarity.
So as an Ayappo member, you really do have the opportunity to influence and make an impact towards better healthcare for all. Thank you very much. Your Ayappo board believes that we need to strengthen the patient's voice in the Asia Pacific region, where 60% of the population live, and where universal healthcare is still an aspiration rather than a right. Ayappo's Asia Pacific Patient Congress is a great platform to bring together the patient movement in Asia Pacific closer together. The Congress aims to bring together the different stakeholders in the region to share their insights, perspectives, experiences, and best practices on the pressing healthcare issues in the region. Allow me to just take you through the first Asia Pacific Patient Congress. The first Asia Pacific Congress was held last 13th to the 14th of November 2019 in Taipei, Taiwan, where 150 member organizations and stakeholders representing 25 countries in Asia Pacific came together to look at how patient engagement can support the harmonization of patient-centered universal health coverage in the region. Delegates participated in sessions on patient advocacy, public policy, health economics, stakeholder engagement, and regulatory policy, including patient focused drug development, clinical trial participation, patient safety, communications, and organizational development, such as resource mobilization and volunteering. The first Asia Pacific Patient Congress concluded by adopting the Asia Pacific Patients Congress Declaration. The declaration urges the United Nations, the World Health Organization, and the Asia Pacific Economic Cooperation member states in the region to scale up, prioritize, and accelerate delivery of a safe, quality, and patient-centered universal health coverage by 2030 that promotes and protects and fulfills the patient's right to healthcare that is available, accessible, acceptable, affordable, and non discriminatory. To this end, delegates urged the member states to keep to their commitments as adopted within the World Health Assembly Resolution 72.6 Global Action and Patient Safety Agenda, Item 12.5, adopted during the 72nd World Health Assembly of May 2019, and the United Nations Political Declaration of the High-Level Meeting on Universal Health Coverage, Moving Together to Build a Healthier World, adopted at the UN General Assembly of 23rd September 2019. The delegates urged member states to create an enabling environment for effective state and patient organization partnerships to participate, engage, and support in the co-planning, co-designing, co-delivery, and co-evaluation of UHC 2030. The patient community underscored the reality that for sustainable health coverage, there needs to be active patient engagement at all levels of the health system decision-making process. The role of innovation and co-creation in healthcare in the region is vital. In pursuit of universal health coverage, Asia Pacific should not forget the World Health Organization's definition of health, a state of complete physical, mental, emotional, and social well being, and not merely the absence of disease. We must bring a holistic approach to universal health coverage that reflects Asia Pacific's societal values of compassion and spirituality in healthcare. And Ayappo and its partners will continue to build on this success and bring it to the next APPC. And we are here today from New Delhi, India, to build on the momentum of the first Asia Pacific Congress and to discuss the importance of patient leadership in health system strengthening. During this pandemic, we look to the Asia Pacific for some best practices in handling the pandemic. You will hear examples of how countries in this region have used innovation combined with national solidarity in implementing world-class evidence-based measures. We will have these discussions about the ongoing pandemic, even as we speak and hear the good news about the approval of several vaccine candidates. We have all learned many important lessons about health in our healthcare systems, and we need to apply and share these lessons so that patients around the world will benefit from this new knowledge. Allow me then to invite you to the third Asia Pacific Congress, which will happen in Manila, Philippines in 2021. We hope and pray it will be a face-to-face meeting so we can all warmly join each other in the spirit of collaboration and camaraderie. Now, I will stop here, and I have the distinct pleasure and honor to introduce Ayappo's Vice Chair, Dr. Neda Milevska-Kostova. Over to you, Neda.
Thank you, dear Karen. Thank you for this wonderful retrospective of what we have done in the last APPC in November. That was a little bit over a year. When we parted last time, when we said goodbye and see you soon and see you next year, we really all hoped that it will be a face-to-face. Unfortunately, the pandemic, we didn't know at that time that it was merely days, maybe weeks before the entire world came to a close down, and actually the most suffered through this and still suffering are the patients, actually our constituency. And Ayappo, together with its members, we had really many things to do and achieve. And we also, like many others across the globe, do not know yet and did not know how will this develop. But anyways, without hesitation, we have continued to work and to really achieve our mission and our goal of having patients at the center of the healthcare, despite the hurdles that this pandemic has presented to us. So since the last time we met in Asia Pacific region, that was last November, many things have happened, at least on the side of Ayappo. And let me briefly give a retrospective of what we as the board, as a secretariat, and our full membership with the support of every member organization we have done over the past year. So in September, we managed to organize the first fully digital Congress, the 9th Global Patient Congress, that was actually supposed to happen in April face-to-face. And we were really faced with the difficult decision of having to really take away the opportunity from all of us to meet like we did previous years and to share our experiences face-to-face, to really see how we can move together and how we can voice our needs and interests. But nonetheless, we had to take that decision, and we pursued to organizing the first virtual Congress. And we tried to make this, to convert this from a challenge into an opportunity, because for the first time, the Congress was attended by 1,200 delegates from over 100 countries. And the delegates had the chance to hear to 64 speakers from 28 countries in 26 diverse sessions. And this is something that we can rarely achieve in a face-to-face Congress. So we thought that actually it was a good opportunity to have more voices heard, to have more voices joined together. I hope we will achieve the same with the second APPC happening today and tomorrow. As I said, COVID-19 took a lot of attention and resources globally. But we at Ayappo, while we understood that this is a very important issue still ongoing to fight with, we still consider that it is important not to leave anyone behind. So we undertook parallel initiatives to really work on other issues, on the non-communicable diseases per se, those that are chronic diseases and that have been somehow put at the back of the agenda because of the ongoing pandemic. For example, we have been doing work in stroke. We've organized a twinning program between the peer patient organizations to exchange their experience between those that have already proven and good track record of helping patients and building the advocacy agenda in their country to help to other countries and to other organizations to learn these skills, learning by doing, and to learn from those that have already done it. So not to be preaching, but rather to learn from an experience, something that we believe at Ayappo to be a very big value that we have, our members with expertise to help the others to build their expertise. At the same time, through this grant, through this initiative, we have awarded 7 grants to our members to conduct a survey on the impact of COVID on the chronic non-communicable diseases. And this was done in collaboration with the National Institute of Health Innovation from New Zealand. This elaborate survey was conducted to hear from patients on what were their experiences. And this will soon be published in a form of publication that will be offered to the academia, to the policymakers, and to anyone interested in addressing the issues of the non-COVID patients, if I can call them that, in their fight with their own regular, chronic, everyday sufferings to make the life better and of higher quality. But besides patients, we have also wanted to show appreciations to others who dedicate their time and expertise to us as patients or patient carers, and those are the researchers. So around November, we have organized a competition and awarded 3 Metrodora Awards. And these Metrodora Awards have been named by the first woman physician who had been working on the improvement of the population health and who wrote actually the first scientific text by a woman globally on health. Our awardees, who were selected by a panel of distinct judges, have been actually leaders in 3 categories. One is the global health leader, and the 2 others are the leader in emerging nations and in the developed nations, the leaders in science and health. And these 3 ladies who have been really chosen from a huge competition are actually those who are contributing with clinical practice, prevention, and patient empowerment in key areas affecting the modern day living, which is the cardiovascular diseases, stroke, mental health, and well-being. On this, in this line, also the part of research and patient empowerment, we have undertaken steps to also build our own community of expertise. During 2020, we have undertaken something that we believe are 2 very important initiatives of Ayappo. The first one is the Patient Academy for Innovation and Research, called the PAIR Academy, which is aimed at providing the comprehensive training and capacity building curricula for expert patients who will engage both in sharing their expertise and experience with fellow members, with fellow patients, as well as participate in the policy agendas and in the health technology assessment or in other panels within their governments to really voice the need and the interest of the patients so that they can all enjoy the rights that are otherwise available in other countries. So PAIR as an academy is a resource that would really help patients be real partners in the role across the continuum of care, especially on the parts of development of the health policies and monitoring and evaluation of their implementation. PAIR Academy already since its establishment concluded a memorandum of understanding with the Duke and US University from Singapore. The second initiative also arose or initiated by Ayappo during 2020 is the Ayappo Patients for Patient Safety Observatory. This observatory, this separate branch of what Ayappo is doing, is really aimed at improving the literacy and fluency of patients and patient advocates to become more than just a research subject. We believe that if the research is done for the patients, then patients really need to play a more active and rather a partner than a mere participant role, whereby they can also be co-creators, co-designers, not only of research questions, but also of understanding the results, choosing the best options for everyone, and trying to contribute with their own perspectives to the research agenda globally. Of course, the research for the research itself makes no sense unless we convert it into real, practical, and usable, affordable, and accessible healthcare. And this is what the Patient for Patient Safety Observatory will also try. So besides the research, it will also try to measure what are the effects and what are the benefits of all the solutions that are brought in some countries so that those can be effectively adapted and implemented in other countries for other patients, and really working towards our mission of leaving no one behind and putting the patient at the center of the universal health coverage that is accessible and affordable for all. All of the achievements mentioned above, we have tried to convert into, as I mentioned, really tangible products that can help not only patients, but also countries in understanding what the patients need and what they would like to see within their improved healthcare and quality of life. So we try to publish the different papers, both in academic journals, as well as different reports, and infographics, toolkits, all sorts of resources that you can find both in the Ayappo website or in the global internet, as well as in some of the booths in today's Congress. More about the Congress will be told by Dr. Ratna Devi. So, as I mentioned, this is our second Asia Pacific Congress. You heard that already from Karen. As well, you heard about the first Congress. We had the opportunity to meet face-to-face last year in Taiwan. And as many of you were with us, I hope, and as many of you know, we had quite a rich program with a diversity that was hard to match. It was really hard to match. However, with the strong leadership of our board chair, who happens to be also the chair of the APPC organizing committee, Dr. Ratna Devi, and the dedication of the entire board of Ayappo and our secretariat and our Ayappo members, to which I want to extend my personal thanks. We actually, I believe, have a program that sets a new standard. And I don't know, Karen, how you will match this in the third APPC. But I would really like to thank for this exceptional program in these exceptionally hard times. And I'm very glad that we are here. And I'm very glad to pass the floor now to Dr. Ratna Devi to tell us more about the aim and the program of the Congress. Over to you, Ratna.
Thank you, Neda, for those inspirational words. Welcome, delegates and speakers, and good morning to everyone from India. As has been, highlighted already by Karen and Neda both, the Asia Pacific Patient Congress was brought to this region with a vision. And the vision was to see patients and patient groups at the center of healthcare, not only in this region, but globally, but more so in this region, because we felt that patient voice was very underrepresented in many of the global fora where patients were called for discussions. We also had a mission, and the mission was to help build patient-centered healthcare throughout the Asia Pacific region in all the countries, not just a few. And therefore, after the first Asia Pacific Congress and the experiences that we gathered from that, we set ourselves four objectives. Our first objective was to bring together all the high level and key stakeholders to discuss important issues concerning patients from the Asia Pacific region. We also wanted to highlight Ayappo's vision in the region to see that patients are at the center of healthcare and use its mission to help build patient centered healthcare within the countries and the nations. We wish to articulate how patients and their organizations can advocate and achieve better healthcare within the framework of a global charter for public health. And this is more important now in view of the pandemic, where public health has become so important. We also had an objective to inspire patient groups to establish national patient alliances in countries that are not represented, that will then align and become members of Ayappo. We plan to achieve Ayappo's mission through several strategies and activities, and this Congress is only one such means. When we built the concept of regional congresses as one-on-one meetings or face-to-face meetings for patients and caregivers to meet and discuss, it was meant to complement our other initiatives for capacity building of patient groups. Our toolkits, our twinning programs, our research brochures, our publications, and many more such initiatives. The Southeast Asia region had its first regional meeting way back in 2013, when Ayappo brought together 14 patient groups to discuss the need for patient advocacy in the region. Then, patient advocacy was unheard and alien. And most groups were curious to know what Ayappo had as a plan. Learning and sharing across countries in the region was nascent, and though a few groups were becoming active, a truly cross-representative alliance in the region was missing. Over the years, several events happened. Notably, the Sharjah NCT Forum in December 2017, the Global Alliance for Patient Access in partnership with the Indian Alliance of Patient Groups conducted a meeting in Delhi in March 2019, the Asia Pacific Innovation Summit, which was conducted in Manila in June 2019, the UICC Congress in Malaysia, and several meetings of the Asia Pacific Alliance of Rare Disease Organizations. Most of these brought together patients of similar therapy areas or disease spectrums together. The agenda for advocacy was high, and the focus was on access to medicines and treatment. However, cross-cutting areas like patient safety, regulatory reliance and harmonization, research, patient empowerment, data and registries, health technology assessment, and financial inclusion, patient authorship, and several such areas were missing. Ayappo believes that for universal healthcare to be real and sustainable, it has to be co-created and co-designed by the patients themselves. For this to happen, patients have to be at the table right from the concept phase and have to be involved in all aspects of planning, not just access to medicines. The delivery of our first Asia Pacific Patient Congress in Taiwan in November 2019, with the theme Harmonization for Patient-Centered Universal Healthcare in Asia Pacific, was our first attempt to bring the patient voice at the center of healthcare in the region. The Congress brought over 150 delegates from across 25 countries, and the verdict was unanimous. We need more of these. That set the course for the second Asia Pacific Patient Congress, which was to be held as a face-to-face meeting in New Delhi. As with everyone else, we adjusted due to the pandemic, but our enthusiasm remained high. The content was carefully curated and topics chosen to cover thematic areas that will really strengthen the voice of the patient to be able to negotiate. Topics such as digital literacy, patient registries, clinical trials and increased participation, patient safety, reducing harm, patient-led research, patient co-authorship, regulatory reliance and harmonization, patient involvement in health technology assessment were included to bring a diverse range of skills and information to the audience. We tried to ensure that every panel had at least one patient representative bringing the patient perspective into the discussion. The next 2 days will bring vibrant discussions and debates with academia, policymakers, industry, and several other experts exchanging thoughts and views. We have over 18 panels, 66 speakers, over 3,000 delegates, and a session on patient-led innovations. We encourage you to join all the sessions and ask questions of the panelists. The Congress is not a standalone event, but part of Ayappo's strategic plans for the region. Apart from agreements and joint working plans with global partners, we are exploring partnerships with local academia and research institutions. And as Neda mentioned, we already have an ongoing MOU with the Duke and US to build patient group capacity in several interest areas. We have twinning programs with 3 countries to build new and emerging patient groups in underrepresented therapy areas as well as geographies. With support from several partners, we have launched a patient academy, and we look forward to learning from Upati on how to build patient capacity in the region. We have 6 published journals, articles, manuscripts with patients as lead authors or co-authors. You will hear more about this in the NCD patient journey, where 2 authors, Narinder and Kanwaldeep, will discuss a little about the manuscript on the NCD patient journey and the touch points. In partnership with the NIHI, we deployed a 9-country survey, as again mentioned by Neda, to understand the impact of COVID-19 on patients with NCDs. Our members in this region from Thailand, Philippines, and Malaysia supported us for the survey, and you will hear more about the preliminary results from Professor Chris Bullen tomorrow. Our work on gene and cell therapy toolkit, patient safety perception index, and several other initiatives are all linked to the sessions of the Congress. We, till date, in the 21 years of our existence, have delivered 9 global patient congresses, which are usually done once in 2 years. We have had 3 regional meetings in Africa, 3 regional meetings in Latin America, several other regional meetings where patients got together to discuss, and today is the 3rd meeting in the Asia Pacific region. Allow me to show you a small slideshow that will highlight the work that we have done in this region and also globally to be able to make you understand what our thematic areas were. Some of this you have already seen in the AV that was shown in the beginning of the, when Karen took you through the beginning of the session. So our first Global Patient Congress had the theme, Trust Us, We Are Patients, and this was in February 2005 in London. The second one was in Feb 2006, Barcelona, Spain, and it had the theme, Together We Can. We then had the third one in making patient-centered healthcare a reality for patients worldwide, and this was in 2008 in Budapest, Hungary. We followed that with one in Istanbul, Turkey in 2010, which said strengthening healthcare systems globally, the value of patient engagement. We followed that up with something called the Achieving Patient-Centered Healthcare in 2012, Indicators of Progress and Success, and this was in London, UK. In 2014, we had the theme Better Access, Better Health, Patient-Centered Approach to Universal Healthcare in Berkshire, UK. In 2016, we had Innovation, Improving Sustainable Access, Boosting Your Reach and Impact, and this was again in London, UK. In 2018, it was in Miami, Florida, USA, which said Globally Empowered Patient Building the Momentum 2018. And as Neda alluded, the last one was in September, which was Co-Creation in Innovative Healthcare during COVID-19, which was the first virtual Congress that was delivered by us. We also had several regional congresses. Our Africa Congress, the first one was held in Kampala, Uganda in November 2008. We then followed it up in 2011 in Johannesburg, South Africa in the month of April. We had one in 4th and 5th July 27 in Entebbe, Uganda. We plan to follow this up with the next one in 2021. We haven't decided the country yet, but we do have an Africa Congress, so stay tuned for more information on that. In Latin America, we had our first one regional meeting in 2014 in Rio de Janeiro. We had one in Panama City in 2015, and the last one was in Bogota, Colombia in 2016. As I mentioned, the Southeast Asia regional meeting, the first one was held in 2013, and it brought together 14 patient groups. This was our first Asia Pacific Patient Congress in Taiwan, which, as we mentioned, had more than 150 delegates participating. And we are here today at our second Asia Pacific Patient Congress. So without much ado, I would like to now move forward to thank our sponsors and supporters. Our sponsors, without them, we would not have been where we are today. Our sponsors and supporters are MSD, Viatris, Johnson & Johnson, Leo, and Roche. Your belief that patients can make a change truly motivates us. I would like to thank my board, the Congress committee, and the operations team, without whose support this wouldn't have been a reality today. Sincere thanks to a special person, Michael Elzona, our dear friend from MSD, who spent endless hours of discussion and deliberation that he patiently attended, providing valuable suggestions and ideas. Sincere and heartfelt thanks to all our speakers for providing us with the time and expertise. And last but not the least, many, many thanks to our delegates for sparing time to attend the Congress. As the chair of Ayappo and the chair of the Congress Committee, I would now like to declare the Congress officially open. Namaskar and Jai Hind. Since we still have some time before we have the next speaker session coming up, which is at 10:15 India time, I would like to also share some thoughts on how Ayappo would build its momentum from the Congress that we are having today to the Congress that we will have in Manila next year. And we already have someone who has volunteered and said that they would like to follow the Congress in Manila in Bangkok. So hopefully we will have more and more members who will come forward and who will carry this tradition of bringing the patient groups together. We will evolve, we will learn, we will strengthen ourselves, we will hold hands, and we will move forward together. The beauty of these congresses, though this one is virtual and there is not much space for interaction, the beauty of these congresses is that people from diverse backgrounds, various nationalities, various languages, break those barriers and meet together. Because for them, the commonality is that they are all patients, that they have all the same kind of challenges that they are trying to overcome. They all have the same needs. They are all battling the same battles. They all have national systems that some of them don't really understand fully. They all have healthcare systems that are not standing up to their expectations. They all have same needs of new and innovative medicines because the older medicines are not working anymore. They all have the same issue of being able to understand the scientific knowledge that comes in simple layman language and translate that with their own lived experiences to rich knowledge that can contribute to policy dialogue at their national level. And these congresses are those platforms that really offer the opportunity for all of them to share their experiences, to come together and exchange what is working well in each of their countries. Also to exchange what is not working well, because these are the experiences that then become the building blocks. They are the ones that help us gather the information from various stakeholders and sit with them and say, if this worked in a particular country, can we change it? Can we build it to the context of a different country and bring the policy change that is needed to make access more simpler, easier, and available? And it works because when patients speak from their lived experience, they are the experts. They are the ones who know their condition best. People, especially with chronic long-term diseases, have lived their experience far more than even the physician experts. They know exactly what works in their body. They know exactly what triggers harmful effects. They know exactly when something is not working well. And if you see caregivers and patients with long-term chronic diseases, they become such experts that they are able to predict when something is going to go wrong with them. And this is nuggets of knowledge that needs to be captured, because this can then shape how we can do earlier diagnosis so that you reduce complications, so that you are able to give healthcare faster and at a more safer place, and which is also acceptable to the people in the context of their country. Also, working with diverse patients and diverse backgrounds has taught us that one size does not fit all. Healthcare needs to be customized, messaging needs to be customized, and how you ask people to change their behaviors needs to be customized as per the local context, local beliefs, local culture, and local languages. And very often, what we get is very westernized. And I'm talking in the concept of the Asia Pacific region. Even our treatment protocols come down to us from other countries because we don't have enough research that can generate that kind of evidence. And therefore, the need is to include patients to generate that evidence that is more culture specific and contextual to this region. And that is where Ayappo, through its new initiatives in research, as well as patient empowerment, can play a very, very valuable role. We have also learned that access to innovative medicines very often comes very late to this region. And that is because there isn't enough patient voice that can negotiate. We also do not have a unified system like, say, the European Union that can build all together, all the patients into one platform. And that additional challenge can actually be converted into an opportunity, because we have seen that there are countries like, say, Singapore, Australia, Hong Kong, that are now signing joint MOUs for regulatory reliance and regulatory harmonization. And these are the countries that are bringing together a rich body of knowledge. As those experiences build and start to benefit the patients of these countries, patient groups from other countries will pick up from those knowledges, from those experiences, and will take it back to their national stakeholders and probably be able to negotiate so that more and more countries start participating in these kind of processes. Access to diagnostics. Very often, diagnostics are also not available. The cutting edge diagnostics are also not available. And while a lot of work has been done on the therapy part of it, very little work for inclusion of the patient voice has really been done for medical devices and for diagnostics. And I think that's a huge opportunity, because in many, many diseases, it is the diagnosis that is delayed that actually leads to complication and failure of therapy. And unless patient groups integrate themselves and understand that early diagnosis and early seeking of treatment could be a better option than actually looking for high value treatment, things will change for them. And therefore, there is a huge opportunity for patient groups to come together to lend voice in not only medical devices, but also in diagnostics and in other areas. And we all know that digital is now moving forward. However, again, this region has this unique blend of very forward nations with high-speed broadband to countries that have got very poor connectivity. So if we have a pandemic-like situation where digital is the way to move forward and telemedicine and telehealth is the solution, how do we then get these people to become digitally literate, not only health literate, but digitally literate, and use those platforms to their advantage? So I look forward to the deliberations over the next 2 days, because these are some of the topics that will be covered in the Asia Pacific Patient Congress. Thank you once again, and welcome to the Congress. Namaskar and Jai Hind.